Welcome to this installment of Dr. Klein's Info Series of Learn with Dr. Klein. And today I want to talk about acid reflux and bloating and how to address the cause as opposed to just the symptoms with natural digestive aids. And you have the choice, actually. Those of you who are receiving this video by email, you have a choice of just following this. It's a less than 2.5 minute read, or just listen to this brief video. And in essence, in natural medicine, we want to treat the cause. And when it comes to digestive issues, the problem is damage to the lining of the stomach and the intestinal wall to some extent. But with reflux, it really starts in the stomach. And the sort of things that damage the lining of the stomach can be things like smoking and excessive consumption of alcohol, fried foods like vegetable oil-based fried foods, polyunsaturated fatty acids, which I talked about, right, and always do, the damaging nature of those types of oils, oxidative stress and all that. And of course, stress, a lot of stress does it. These situations are closely related to depression, anxiety that is associated with stress. So as a result of that, people who otherwise be able to eat sort of standard foods, like say, I don't know, a piece of bread, wouldn't be able to. And so you think, well, the bread causes it, but usually there are other things. Stress is a big one because stress suppresses the cell's ability to function properly, whether it's a stomach cell or a brain cell or a bone cell or any cell. And of course, cortisol is suppressive. And so and indeed, smoking and alcohol consumption, excessive alcohol consumption, and consumption of polyunsaturated fatty acids raises cortisol. So ultimately, the response is a stress response, suppressive, cells don't function well. And those cells produce digestive juices, produce enzymes to help us digest our food. And when they're damaged, they cannot, these enzymes, they don't produce the enzymes as well. There aren't enough enzymes, there aren't enough digestive juices to digest the food properly, hence reflux and bloating and so on. And typically in the natural health environment, some of the most commonly offered or suggested digestive aids are digestive enzymes, which is great for one meal at a time, really, right? So it's temporary relief. So how do you address, how do you provide long-lasting healing? How do you deal with the cause? Well, to treat a cause, you need to treat the lifestyle factors that are causing this. But from an over-the-counter perspective, there's still things that you can do to provide deeper and longer-lasting healing. So, for example, vitamins thiamine, niacinamide, and pyridoxine, vitamin B6, are needed for the production of the digestive juices. And vitamin B6, pyridoxine, is often used by some of the digestive enzymes, a cofactor. So those are important. We know that deficiency of these vitamins can actually contribute to digestive issues. So that's another cause. So having enough of these is really important. And then, of course, you can also use agents that decrease the stress hormones, cortisol, and their negative and suppressive effect on the digestive tract and digestive cells. So back to rhodiola rosea, great reducer of cortisol. Actually, chamomile, which is good for digestion, also reduces stress hormone, and so does tangerine peel. And there are other herbs as well, of course. The nice thing about chamomile, it's very versatile. Actually, it helps to heal the digestive tract, the mucous membrane themselves in the digestive tract, heal the cells, and also it has a calming effect on the nerve endings, which govern and regulate digestion. Studies have shown improvements in ulcers using chamomile, and of course, it's given for babies for colic. So it's very versatile. And ginger is another one. It's an anti-inflammatory herb, just like turmeric, say, for example. These are anti-inflammatory. Inflammation is basically a response to damage from the sort of things I talked about. Ginger heals that, good for nausea. And artichoke helps to stimulate bile, and that's important. It actually supports liver function. Liver produces also certain enzymes and regulating substances that are involved in digestion. And the production of bile is really important for the assimilation, the absorption, and digestion of fat-soluble nutrients, fats, just fatty acids, and fat-soluble materials, nutrients like vitamins, vitamin E, D, K, and so on. And um, there are other herbs that help to act as carminatives, to break down gas. They make digestion more easily. They also stimulate production of digestive juices and enzymes like cardamom. And so those are the sort of ingredients that are in the Rosiva Digest. And you have there, yes, you have digestive enzymes. More importantly, you have these digestive agents, these plants that help with long-term healing, and the vitamins that you need to help produce the digestive juices and support the overall energy generation functionality of these cells. So it also has thyroid support elements. Why thyroid? What does it have to do with digestion? Well, if you don't have good thyroid function, nothing is functioning really well, because the ability to produce energy to function well is not there. All of these are in Rosiva Digest, and if you'd like to try it, to receive a sample, then just let me know, let your representative know, and I would encourage you to give it a try. Recommend it to some customers and get, listen to the feedback, and I'll think you'll be pleasantly surprised. So there are going to be some customers who are going to be elated, and I've seen that time and time again, where people were able to get off their anti-acid medications and not even need to take the Rosiva Digest on an ongoing basis, just every now and then, because they've gotten so much better. That's it. Sorry for that. Thank you for watching. And again, you can also just read the outline. Thanks so much.